Hold on, Patrick. Are you monitoring whether your colleagues are at work or you are? What exactly are you monitoring?
Okay, thank you. The issue is since the inception of this strike, we've been receiving threats from some of our employers and the government officials. So at least it is better for us to go around to see whether our members are safe within the vicinity where they found themselves, because some of our members too stay inside the hospital quarters. You could see most of our members being intimidated that they will not be validated this month, meaning they are not going to be paid because they are on strike, left, right, center, from CHAG, from the Ministry of Health and other agencies. They are threatening our members, and they rather turn around to inside the public that our executives are intimidating those who are at work working. Meanwhile, it's not true. If you listen to some of the communicators from the ministry, they are asserting that our executives are intimidating the nurses who are working. Even those nurses who wrote that they are not partaking in this strike, they are not at the facilities, but the employer is deceiving the public that there are people there working. They are our friends in our facility.
We'll come to that.
Not working.
We'll come to that. But having listened to some of the sounds that are played, having listened to Clinton narrate the situation on the ground, as a health worker, as a nurse, somebody whom I'm sure might have taken some inspiration from Florence Nightingale, what do you make of the situation of the patients out there?
But we are all not happy that we are on strike. But if the posture of the employer depends that they are not ready to negotiate with us, we cannot also go. Because if you listen to all the employers, their communication and other things, it depends that they are not ready to listen to us. Because if you have a genuine case, a condition of service that was signed in 2024, endorsed by the Chief Executive of the Fair Wages and Salary Commission and the Chief Director of the whole Ministry of Health, and you tell us yesterday that you didn't incorporate this condition of service in your budget reading, it means it's deliberate, because there is a handing over process that went on, of which the Chief Director should have briefed the incoming government that this is the situation at hand. Last year there were negotiations for negotiation. The GRNMA condition of service, because of so and so, was not part of the implementation. So this year, let's consider it. And you tell us during yesterday's meeting that you couldn't factor into the budget. First, from January, we've been meeting the ministry upon ministry, we're meeting them with this same condition of service. So it means it's deliberate. Uncle Dave.
So I'm happy that and earlier you talked about the fact that they didn't want to meet with you for negotiations. But I'm happy that you mentioned that you met with them yesterday, only that yes, you were not able to come to some kind of understanding. Now, the concern is that this agreement you talk of was agreed upon or signed in 2024, yes or no?
Yes, please.
This is a new administration that tells you, well, they didn't know much about it and so could not factor it in the budget. That's what they said, yes or no?
That is the worry. Why should we say that? It's a transition thing.
No, but have you checked whether in terms of the transition, they were informed, they were given this information?
There is a failure on their part, not our part. They should admit it. There is a failure on their part. There is a failure on their part, because as a ministry, even if there's no minister, the system must work.
But at least they have made a proposal, Patrick.
The administrative process should work.
In all this,
tell us that you didn't factor it into your budget. Then it's a failure on your part.
Now they are telling you that what they can do under the circumstance is to factor it in the 2026 budget. It doesn't work for you?
That is not fair. That is not fair. And I don't think they will do that.
What do you mean by you don't think they can? No. Why do you say that? Based on what?
It's not fair. Why should you negotiate on condition of service in 2024? Then you tell us to implement in 2026. This is not salary. It's conditions of service. It's the service that you're rendering, the conditions that is attached to it. And these conditions, it includes our leave, it includes our rural incentives, it includes our health care. So if you tell us to wait 2026, who will cater for us when we are ill?
The argument,
salary increment for you to say you'll be paying it in 2026. This is the conditions that we work in. We work in highly contagious areas and we contract diseases. And you tell us that, no, you wait next year, then we will foot the bill for you. Whilst our members are contracting infectious diseases, just that with disease condition, you cannot publish it. You get it. And they are suffering.
They said they didn't factor it in the budget.
Drugs because they've come into contact with other infectious patients. They are on drugs. You get it. And
you're saying nurses are on drugs?
And others.
Hold on. Did you say nurses are on drugs?
Yes.
What kind of drugs? What drugs are you talking about?
We suffer a lot of issues in the health sector because there are logistic constraints. You can even be pricked by a needle when attending to a patient. And with that, they have to put you on antiretroviral drugs. There are a lot of members on antiretroviral drugs because of the conditions you work in.
So
And
you're talking about medications. Hold on. When you say drugs, it could connote something else. You're saying
I'm talking about antiretroviral drugs.
Medications.
Because of our exposure to patients that we are managing. And you tell us that we should wait for 2026 before you pay 100% cover for us, or before you give us free treatment.
To a large extent, expenditure.
Is this fair?
Listen, to a large extent, expenditures are made when you have a budget for it. Under the circumstance, they didn't factor it in the budget. They can cater for you in 2026. Where do you expect them to get the money
from? I don't hold that assertion, Dave. I don't hold that assertion. In health, the exigencies of the time will determine whatever. When COVID-19 came, there wasn't any budget allocated for COVID-19, but it was an emergency. If health is a priority for the nation, anything can be done. Anything can be done. So it shouldn't be that it is not in the budget, so we can't cater for. If the agreement is valid, the government can do whatever means to get resources to finance it.
So why didn't you embark on a strike action in 2024?
Why?
Didn't you embark on this strike action in 2024?
David, we've been explaining these things since the inception of this strike. Because of let me see. We signed the conditions in May, and the implementation was supposed to start in 1st July 2024. And a session of our members, that's a union that they are propagating that will not go on the strike. They took the condition of service agreement to court and enjoined the Ministry of Health, they enjoined the Controller and Accountant General, and they enjoined the Attorney General not to implement. So we went to court from that time up to December and resolved the issue. So that is why the condition of service was not implemented. But all the other health sectors, their condition of service were implemented. So it wasn't the case that the previous government negotiated and they know that they don't have money. They implement for everyone, except ours because of the court issue. So we don't want people to be saying that the government deliberately negotiated and they didn't want to implement. No, they implemented for all the health sector union, except ours, because of the injunction.
Would you say that you are law-abiding? Would you say that nurses are law-abiding people?
Yes, we are law-abiding.
If you are law-abiding people,
how can we even give a roadmap and give allowance of about 1 week?
But the High Court has described. The High Court has
for the government to negotiate for 1 week before you embark on the full-blown strike.
Patrick, the High Court has described this action of yours as illegal. It was sat on by Justice Priscilla Dikro Ofori. She presided over it and has described it as illegal. So let me get the date for you. 5th June, thereabout.
No. We've not been served. Maybe someone has gone for an injunction. So the injunction needs to be served on us. We've not been served. And I've not even heard it. I'm first hearing it from you. So the court has not sat on any issue. Maybe an entity has gone for an injunction, and that injunction needs to be served on us. So they should serve it on us.
So this agreement you're talking about, the conditions that you are expecting that you receive, remuneration for, list it for us. What are these things?
My brother, as I said earlier, these conditions are not salary increment. The first one is free health care for all nurses and midwives within the health sector, and 50% for our spouse and 4 children. This is done for any other institution. You'll be in the health hospital, other institution will come, you cater for them free of charge. But if you fall sick, we pay. The second one is our PIN renewal. That's our license renewal. As a nurse, when you complete your license exams and you are working, you need